Thank you.
This is really refreshing.
Yeah, right.
Good. Definitely. Well, first of all, I'm Representative Kelly Fenton. I'm here with Senator Karin Housley. And we want to thank you for being here today. And the reason we're here is we want to introduce you to the Vivian Act. This is new legislation that we've introduced to promote education, awareness, and detection of congenital cytomegalovirus, otherwise known as congenital CMV. You know, this piece of legislation is a perfect example of your citizen legislature hard at work. This legislation was brought forward by Leah Henrikson and her husband Matt and their daughter Vivian. And this is an excellent idea to raise awareness regarding congenital CMV. So this is something that we will be advocating for hard so that we can get this signed into law over the next session. What this legislation does is it requires the Minnesota Department of Health to make up-to-date and evidence-based information to health practitioners, expecting parents, and families of children born with CMV. So this is something that can be passed from a mother to a child. And with that, before we introduce the Henrikson and some of the other parents that have been affected by this disease, I'm going to turn it over to Senator Karin Housley. Thank you.
Thank you, Representative Fenton, and thank you for coming. I'm Senator Karin Housley. I want to thank the people behind me and the Henrikson family for making me aware of CMV. Having 4 children myself, I had never, ever heard of it, and I have 1 grandson, and my daughter is pregnant with her second. And when they came to my office and told me all about Vivian and CMV, the first thing I did was run home to my daughter and say, have you ever heard of this? You've been to all the prenatal classes, and you've been visiting with your doctor. Have they ever mentioned CMV? And no, she had no idea what it was. And her firstborn son actually failed his hearing test, and a CMV test was never done. It's much more common than I ever knew, or my daughter ever knew, or any of us knew. 1 in 150 babies born each year is affected, and 1 in 5 of those children develop long-term health problems, including hearing and vision loss, intellectual disabilities, small head size, lack of coordination, weakness of muscles, cerebral palsy, and seizures. What this bill will do is get information early and better understanding so it can lead to better outcomes for Minnesota kids. Other states have taken action on legislation related to CMV across the country, and it provides information to doctors encouraging testing babies who fail their newborn hearing screening. And with that, I want to introduce the Henrikson family, Matt and Leah and Vivian.
Hi, everyone. My name is Leah Henrikson. This is my husband, Matt Henrikson, and this is my daughter, Vivian. Before I share a little bit about our story, I have a lot of thank yous to give. We're so grateful to be here, to have a bill named the Vivian Act after our daughter, and to bring awareness to CMV. So I want to thank Representative Kelly Fenton and Senator Karin Housley, and then the families behind me for their inspiration and their support. Also, Dr. Mark Schleiss, who's with us, who is an infectious disease specialist at the University of Minnesota and specializes in CMV. And the families behind me, we've all been so lucky and fortunate to work with him right here in the state of Minnesota. So this is Vivian. Vivian was born with cytomegalovirus, or CMV, and we had never heard of CMV. And I'm here as a mom because I need for other moms to know what this is. We had never heard of it. Vivi is my second pregnancy. I had a son, Asher, who is 5 as well, and never once was this mentioned. Less than 15% of expecting mothers have heard of CMV, yet it's more common than Down syndrome, fetal alcohol syndrome, and neural tube defects combined. So when I was pregnant, I knew it was a great idea to take folic acid. I knew it was a bad idea to drink alcohol. And I knew at being over 35 what my options looked like for Down syndrome testing, but no one mentioned CMV. So CMV for us, for Vivian, it has showed up, and she had a small head size at birth. She did fail her initial hearing test, and it did cause brain damage, which she now has cerebral palsy. And the families behind me, we all have different stories and different journeys with CMV, and we feel that we are just tremendously lucky. We're very lucky. We're lucky because our doctor had heard of CMV. Many have not had that dialogue with their patients. And Vivian was tested for CMV before we ever left the hospital. So her treatment started immediately with medication, physical therapy, occupational therapy right away before 2 weeks of age. Not all families have the same story that we have. They go on a very long journey to find a diagnosis because it was missed at birth. CMV was missed at birth. And I often hear from these families that they just wish they would have known. They wish they would have known why their child was missing those milestones so they could have gotten the therapy that they needed for their child right away. So let's prevent more families wondering what could have happened, and let's start the dialogue of CMV. So thank you for letting us be here. Thanks.
Thank you so much for being here, and it's a real honor and privilege for me to be with these families up here who I've worked with and engaged in dialogue about knowledge and awareness of CMV. And I have to give Leah and her family enormous credit for having the initiative and taking the reins and moving this initiative forward, and also as Leah mentioned, our representatives and senators here. There are many co-sponsors on this bill, and I'm very excited about that, and I'm very hopeful that this will move forward. Every family here has a story. I also want to acknowledge Angelita Soto is here. She's my nurse coordinator at the clinic at the University of Minnesota, where we've had the privilege of working with many families. And the one point I guess I would like to stress is that CMV not only impacts children's health, but it's really about women's health too. There are complications and concerns that can arise if a woman acquires a CMV infection during pregnancy. And so we have a number of personal stories here. If you're willing and we have time, maybe we could hear from some of the families for a couple of minutes. I think that we could certainly start with the Baumgartner family. We're here today with Kelsey and Louie, their daughter Beatrix. And Kelsey, maybe you want to just say a couple of words about your experience with CMV.
My name is Kelsey Baumgartner. I'm from St. Paul, and when I was 26 weeks pregnant, I became very sick, fatigued, had low-grade temps and didn't know why. Went to my OB a few different times, was turned away for reasons, it's just regular pregnancy things. And then when I went back insisted, he called an infectious disease doctor, who in turn ended up testing for cytomegalovirus. As soon as we found out that it was positive, within the next 2 weeks, I was fully paralyzed in the hospital with Guillain-Barré during my second trimester of pregnancy with my second child. We were lucky that we caught the CMV. We're still on our road to recovery, but we knew to test our daughter for CMV at birth. She was born totally asymptomatic, and we were lucky that we got connected with Dr. Slice. We chose to do the treatment for CMV. She's 1 year now and is showing no impact from the CMV, but her future is still unknown. So we were lucky that my doctor caught it and that we knew to test for it in our daughter, but had we not known that I was diagnosed with the CMV prior to my diagnosis of Guillain-Barré, we don't know what her future would be.
Thank you. As we've heard, as I've heard from many families over the years, many families that are affected by CMV will tell me the same thing when I meet them for the first time, that I've never heard of this virus before. And so in an era where everybody's heard about Zika virus and the impact that that has on infants and newborns, that's extraordinarily rare still in the United States compared to CMV, where we think 1% of all newborns in the United States every year, up to 40,000 babies a year, are born with this infection. We also have Stephanie Peterson and her daughter Sadie here. And Stephanie, you wanted to say a couple of words about your experience?
I'm Stephanie, and this is my daughter, Sadie. We're from the Mankato area. Sadie was born about 37 weeks. When she was born, she was very small, about 4 pounds, 15 ounces, covered in little red dots, petechiae. She had all the classic signs, swollen heart, swollen liver, swollen spleen. She had microcephaly. She was airlifted immediately to Rochester. And they kept her in the NICU for about 3 weeks, started her on the antiviral medication. Right away, she was diagnosed about 2 days afterwards with CMV. She did pass her hearing exam on the first test. She's just been through so much. I mean, PT, speech therapy, occupational therapy. We do have her in the audiologist every 6 months. This last time she did have some high-frequency hearing loss, so it's just a matter of time. We don't know, if she's going to lose her hearing, so it's tough. You never know what the outcome in the long run is going to be. So her long-term diagnosis right now is CP, but she does do really, really well. That's Sadie's life.
So the Hagstrom family is here as well with their son Cody, and Cody is perhaps the best dressed person on stage, sporting a very handsome necktie. So I'd like him to show it off to all of you if you want to make a couple of comments. Okay.
Hi, I'm Abby Hagstrom. This is my son, Cody Hagstrom. My husband's here with me, Zach Hagstrom. We also have a 3-year-old son, Max. I had what I thought were both healthy, normal pregnancies. With Cody, though, I did have a really bad cold, and I called my OB and said something's wrong, something's not right. I'm really struggling here, and they basically turned me away and said, you'll have to see your primary care provider. So there was a place that maybe some intervention or some education could have made a big difference for us, possibly. Cody failed when he was born. He failed his hearing screen 3 times. They told me, don't worry, he had a C-section, he's just got fluid in his ears. Don't worry, you don't need to rush to audiology, but you'll need to go get it tested at some point. So there, for me, was another piece where if it had been top of mind for the healthcare providers, maybe things would be different for us and our family. Flash forward now, Cody's 18 months, and he's just now sitting on his own. He's got cerebral palsy. He's just about deaf in his left ear. We have at least 4 therapy appointments a week that he goes to. He struggles every day. Some weeks we have up to 6 appointments. He's got 11 specialists that we see. And through all it, he's so strong, and we're just going to do whatever we need to. But my husband and I constantly look back at all those points where maybe if it had been top of mind for healthcare providers, maybe Cody wouldn't have cerebral palsy. Maybe he'd be walking. Maybe he'd be standing on his own. So just, I'd really like it if you'd think about, Cody's story, and thank you for letting us share.
Thank you for sharing your story. These are intensely personal stories, and I really appreciate you taking the time to talk about your family and about Cody. And that's really the goal of this bill, is to try to increase knowledge and awareness so that women know about CMV. I wanted to also have Stella Rowling just say a couple of words about her experience, because in her case, identification of CMV while she was pregnant allowed the opportunity for earlier intervention. So.
Hi, my name is Stella Rowling. I'm from Maple Grove. This is my little guy, Alex. You want to have a seat? Likes to style hair sometimes. I was 26 weeks pregnant and very sick, had high fevers, went to the hospital, saw my OB. They just thought I had just a cold. They weren't really sure. So I went in a few times again to get tested because this was not going away, this high fever. And actually it was my husband, who happens to be an ER doctor, asked our OB to test me for CMV. And the results came back positive. I had a primary sort of first-time CMV infection. And immediately we met with a few doctors, and Dr. Slice was someone who came in and helped us out and started me on a program. I got some infusions at the hospital of cytogam. I had 3 infusions while I was pregnant with Alex. And fortunately, our case turned out great because Alex did not contract the CMV virus. So I personally believe it was because of that intervention that we had and the doctors here in Minnesota who are so great. And so, like all the families up here, I would love to have this bill passed, and thank you so much for your time.
So the last family, Dan Gorger and Heather McElroy, they're here today with their daughter Hazel. I think she must be out getting a bottle or something. So, but would you like to just say a couple of words about your family's experience? Okay.
I'm Dan Greger from St. Paul, Minnesota. So our experience, Hazel presented very fortunately with pretty low symptoms of CMV, which kind of delayed any diagnosis. So I think what's so important about this legislation is that more information may have sped up that diagnosis, which in turn would have got some treatment earlier for our daughter. And I think that's why this is so important to go through. Thanks.
Well, you know, as you hear the stories of the families, I think Senator Housley and I cannot thank the families enough, and Dr. Slice. And I need to thank the Minnesota Department of Health, because they too worked with us on this legislation. And I myself had 3 children, and I had never heard of this. And when we got our draft of the bill and I took it around to start to garner that support, many of the legislators I'd asked to sign on had never heard of CMV. So I think we've seen today why this is so important. I feel like Senator Housley and I did the easy thing. We said yes to carrying this legislation, and we're going to start the hard work to make sure this is signed into law. But it is because of the hard work of all of the people who are standing up here with us right now that this will and can become reality. And because of their hard work, the pregnant women and newborns in Minnesota are going to be far better off. So with that, we will be open to questions.
Just one quick question for you. I got so many questions. The kids are kids. Their attention span is not this big. So just one question I want answered on camera, and I'll talk to you off camera. What does the act do? I mean, how are you getting the information out? How will this act function?
So there are a few things. Basically, this is what we chose to do with and working with all of the groups is to start with the education, awareness, and detection of the congenital CMV. So The Department of Health, essentially, we're going to be working with the Department of Health to put together evidence-based information to the health practitioners that they can get to expecting parents and families of children born with CMV. So this is from at the very beginning with the prenatal care all the way to the hospital when the newborn is born and they start to do the screenings. And I believe that it was Leah Henrikson, you had somebody who actually knew about it that said something to you at the hospital. And so we are starting with that piece of it, working with the Department of Health to disseminate this information to all of our practitioners and get it out there, start to build the awareness, encourage them to talk about it with expecting moms, encourage hospital workers that work with the newborns. If the newborn, another piece of it is the newborn fails a hearing screening, to recommend a follow-up as they visit the pediatrician to ask that this test be performed if the parent so chooses. As other states are enacting legislation related to CMV, some states are going the route of education like we chose to do. Other states are going on both education and testing. But we truly believe the first thing is to build awareness and have the education component, because that will make the impact. And then families can also start to advocate for Leah works in a corporation with many pregnant women there right now, and she's talking about it with everybody. But I think education, the knowledge of power, can make all the difference in your health care. Did that answer your question? And I have a copy of the legislation if you'd like to get it later as well. Any other questions?
No, good. Yeah. Thank you all for coming, and hopefully you will go out into the world and tell pregnant women about CMV too. Thank you, and thank you to all the families, and thank you, doctor. Thank you.